My name is Tasha Portley. I'm a nurse navigator with Trinity Mother Francis. I am one of the many links within patient-centered medical home. As a nurse navigator, we strive to ensure that the patient experience is as seamless as possible through our healthcare system. We all know that can be difficult at times. Some examples of how we do that are disease management, patient education, financial assistance, and communication with other members of the patient's healthcare team. I recently had an interaction with a patient who struggled to control her diabetes. I was able to coordinate with her primary care physician to ease some of her concerns and change some of her medications. This is one example of my role.
My name is Serena Dawson. I'm a nurse navigator with Trinity Clinic. My role is to pretty much help patients stay out of the hospital, also help them to have access to someone to talk to, whether it be doctor, financial services, you know, any part of Trinity's system. That's what they call it, a navigator. We're supposed to help them navigate the Trinity system. That is very important because all of us know that if you are trying to find out information, it's hard if you don't have someone to help you. So we're there to help them and act as a resource for them. There's one patient that always sticks out in my mind in the past, and it's a patient that had a chronic genetic disorder that caused them to have elevated cholesterol in their bloodstream. That patient had been on every single medicine they could be on, multiple heart attacks. And basically, you know, how I could help the patient was I made one of their medicines was going to interact with another one, which could have caused a lot of problems. I alerted them and the doctor to that. And so that's kind of how I helped him. Just information, you know, a resource, someone to help, someone with a second brain to kind of think about these things when the patient's in it and it's hard for them to, you know, sometimes come up with a solution when they're so bogged down by their medical condition or what's going on in their life. So sometimes just that clear mind of someone else can help a lot.
My name is Judy Tatum. I'm an LVN care coordinator for the patient-centered medical home at Trinity Clinic. As a care coordinator, we do pre-visits prior to a patient's appointment. We take a look at their chart to see what preventative things they are missing, as colonoscopies, mammograms, bone densities, diabetic eye exams. We take a look at their labs to see what labs are due according to their disease. If they're on medication that need to be checked routinely, we make sure that those labs are in. We make sure that their immunizations are up to date in their charts. As we do our pre-visits, we check to see if our patients are signed up with MyChart. If it's activated, we encourage them to do so. We make sure that they get their activation code, and we tell them that if they need any assistance to give us a call back. Everybody knows that they need their colonoscopies and that they need their mammograms, but we give them that extra push to get it scheduled. You know, leaving it up to them to call in later doesn't always happen. So if we can get those procedures scheduled while we have them on the phone, they get it done. We try to emphasize that we are a part of their physician's team. That seems to help. Patients are a little leery at first, you know, not knowing who's calling them or why we're in their chart. But once we make it known that we are part of that providers group and that we're there just to help and to free that physician up to where during their appointment the doctor can concentrate on what they're actually there for rather than preventative services, they seem to be a little more receptive. I have a patient recently that I did a pre-visit for, and I noticed that their A1C was elevated, and I spoke with them to see if they were checking it, and she was not. She said she couldn't afford the strips and that she just didn't have the time. So I put her in contact with one of our nurse navigators, Susie, and she has since then called me from time to time to see if what she was doing was correct.